We are very excited now. You know, it's been such a great day hearing from all of our excellent keynote speakers who have come from all of their respective organizations. You know, we had community engaged research experts. We also had funders who are really innovative in this field. And now really we're very fortunate to have actually community partners that are working with us here at Stanford to share their perspectives. And so I am honored actually to really introduce my partners who've been working with me now for the last, some of them for 10 years, some 3 years. But Cecilia Castro, who's there in the center, she's the Deputy Director of the Dolores Huerta Foundation, which serves the San Joaquin Valley region of California. It's a social justice organization, and they're also focused on health equity. And Christina Hecht, who's sitting there on the other side of Cecilia, she's the Senior Policy Advisor for UC Nutrition Policy Institute. And I think this partnership you'll hear, it's really great because it's actually a partnership between academia, but also community and policy. So you get that whole translation aspect. I'm now going to pass it on to Stephanie Smith, who's going to tell you a little bit about her partners as well.
Thanks, Anisha. So I'm Stephanie Smith. I'm in pediatric oncology, an instructor currently with a focus on pediatric oncology, cancer survivorship, and health equity. I'd like to introduce you to the Jacob's Heart organization, which is Jacob's Heart Cancer Support Services. It's a nonprofit organization that was founded almost 25 years ago and serves families of children with cancer in the Salinas Valley, really including an entire catchment area, including all of Monterey County, Santa Cruz County, San Benito County, and South Santa Clara County. And we're really honored today to have with us Heidi Boynton, who's the executive director at Jacob's Heart, a trusted friend and partner in the research that we're doing together.
Thank you so much, Anisha and Stephanie. I'm Janine Bruce with our Office for Child Health Equity, and I, along with Dr. Ryan Pedrez, have the great pleasure of helping to moderate this session. We thought a really great way to kick this session off was to hear the experiences and stories of our partners, our community and policy partners, tell their story about how they have worked with Stanford over the last several years. Heidi, do you want to kick us off?
I will. Thank you for having us here. It's an honor to be here and share our story. As Steph mentioned, Jacob's Heart focuses on supporting families whose children have been diagnosed with cancer or bereaved by the loss of a child due to cancer. I've been the executive director for a whopping 13 months, and about a week after I began that role, one of our board members at our board retreat expressed her sadness and confusion and fear about her son, who was 27 at the time, and had a brain tumor when he was 6, a lot of surgery, a lot of treatment, and really was struggling to thrive and move into his adult life. Health complications, social emotional complications, and just really not knowing as a mom how to support her son into this next phase of his life. Our work day in and day out is really the minute a child is diagnosed and helping that family get what they need to support their child and then the other children they may have. But the part that we were missing was this survivorship story. What happens after a family really leaves the day-to-day services of Jacob's Heart, launches back into their life, but still has this main part of their story, which is a child who endured the treatment and surgeries from pediatric cancer. And so about 3 seconds after that conversation, I got an email from Amal, who works with Stephanie, who was one of our trusted social worker connections, where we get our families referred from, that introduced us to Stephanie and what she was imagining doing for the families in Salinas Valley, which is where we serve. And so the marriage was immediate, but the reason it worked so well is based on everything that was mentioned earlier, which is trust. We had this trust built already with Stanford. We worked very closely with the team. And so we knew that with that trusted relationship, they would be able to come in and help us think about how we could do our work better. We have a saying at Jacob's Heart, once a Jacob's Heart family, always a Jacob's Heart family. And we were actually missing really hitting that on the mark completely. It sounded good, and it sounded true most of the time, But when a child becomes an adult or a young adult, we really were missing that part of how to serve them best and support them. And so Stephanie came, we met, she shared her vision, shared what she was already doing here on campus at Stanford for survivors. And it rung true to everything that we wanted to do. And it wasn't so far off of what we could implement. So much of what we've been able to do, and we're going to talk a lot about the benefits, but the success for us has been that what her ideas generate, her interviews generated, the ideas are something that aren't a big stretch for us to reach for. We have support groups, we have family support specialists who are case managers that can start to reach those families that maybe had left the Jacob's Heart circle, and then we could bring them back in. So over the last year, Steph and her team have been working with our staff to identify families, prior staff members, current staff members, the parents, the children that were diagnosed, now adults, young adults, and interview them and learn what is going on, what they need, what they don't have access to, and take that information and look at what can Jacob's Heart do, what can Stanford do, what can all of the systems do to support these families all the way through and make sure. So we're hopeful for what's ahead as we keep asking good questions and looking at how we can collaborate with the work that we do on the ground in the community with her science mind and make sure that families are well cared for.
Hi, everybody. My name is Cecilia Castro. Like Anisha mentioned, I'm the Deputy Director for the Dolores Huerta Foundation. I'm just super excited to be here. And believe it or not, this is probably one of the first, well, actually in 2-3 years that I've actually met some of our partners, like Christina. So this is super exciting to see everybody outside of the little Zoom box. So we are a community-based organization, and our goal is to empower community members to advocate for health and racial equity in their schools and communities. We work in the areas of Kern, Fresno, Tulare, and Antelope Valley, which is the high desert area of LA County. And we help community leaders understand government systems, including schools, so that they can make improvements and advocate through policy and systems change. And so using that model, we work with predominantly agricultural workers, farm workers. 90% of them are monolingual Spanish speakers, and a small population of African American low-income communities. And the majority of them are women. And so they have formed these education committees where they're learning about their schools, they're learning about how, the process to do advocacy. And so we've continued using this model, and when school closures happened, we continued to listen to our community members. We were hosting conference calls with community members, and the number one concern across the 12 chapters that we have in the Central Valley were that food was the issue. I mean, parents did not have access to their school meals. I mean, these are students that are in low-income school districts. They're all benefiting from the free school, from the school meals. And they had issues with being able to pick up the meals. I mean, whether it was issues of transportation, the location where they needed to pick them up, the hours where they could pick them up, the fact that they needed to take their children to be able to pick up the school meals. And we were very concerned that we sent out an SOS to one of our funders at the San Joaquin Valley Health Fund and said, we really need help, because we also learned that school districts would not be able to provide school meals during the breaks, whether it was spring break, and then we knew that summer break was also coming up. And so luckily, this program officer, Ellen Bajardo, at the time, knew of Dr. Anisha and Christina, who they had worked with in the past, and said, we have the perfect folks to connect you to. And so we were, we really hit the jackpot in being able to have these these researchers and policy advocates to work with us, because it really built our capacity to be able to then assist community members with their immediate needs. So for example, our policy partner was able to give us information, timely information that we needed from the state about waivers and other things that school districts could be utilizing to help remove those barriers for parents to be able to access food. And then, of course, it blossomed into a partnership with Stanford in being able to research what are those barriers and facilitators to participation in the school meals, that then we were able to take to school districts and be able to advocate for them to remove those barriers. Parents were able to participate in, for example, a photo voice project where they actually took took pictures of their school meals for an entire week, and then were able to take that information to their local school district. So it didn't really just stop at policy recommendations, and it didn't stop with the research. It also meant that our parents took that information. They were able to change the pickup locations. They were able to change the hours where they could pick up the meals. They had buses that were actually transporting the meals in the rural areas. And now we know that California, of course, is offering free school meals for all, which is a really, really big achievement. And I would like to say that it's part of all of the work that food advocates and community-based organizations and researchers have done to make this happen for our families.
Terrific. Thank you, Heidi and Cecilia, for sharing more about your organizations and the story of your partnerships. So, well, let's dig in a little bit now, and this is a question for all three of you, to share a little bit more about the benefits and challenges of community engaged research, sitting from the community side. And maybe, Christina, we'll start with you, since we haven't heard from you yet this morning.
Hi, everybody. I want to do two things. I want to make sure, first of all, that everybody understands that during the pandemic, schools were closed. USDA had authority from Congress to offer something they called waivers to provide flexibilities to school nutrition programs to prepare and provide meals to kids even though they weren't in school. So just a little background for what Cecilia was talking about in case you don't have kids in elementary school. I want to jump on something that's come up in a number of questions, which is we do the community work together, but what happens next? And I think that from our partnership, we can tell a number of stories about that. For example, the Photo Evidence Project. If you know how Photo Voice works, community members use their photos to highlight issues for them. Then in focus group work, they talk about these issues and decide where to go next with them. Well, one of the issues that came up in the photographs of the children's meals was how many food items were high in sugar. This was upsetting to the parents. So we've been able to take that a variety of ways. First of all, we created a one-page infographic with photos of these sugary meal items, quotes from the parents, and then citations from the academic literature on sugar content in school meals and the nutrition of school meals. That was a one-page brief so that it's very quick and easy to understand. But we also took that brief and translated it back into Spanish so that the parents could see the result of their Photo Voice project and their advocacy. And this was a really critical part of what we did because, as Cecilia mentioned, the parents are mainly Spanish speaking. So for them to see their work in a language they could read was very empowering. It's a very, very moving part of what we did. And the parents then were able to go to their school districts and say, we want less sugar. And in some cases, for example, Fresno Unified, the third largest school district in our state, they reduced the amount of chocolate milk that they serve to the kids, which is one of the big sources of sugar in school meals. But on different levels, we took that same information to Washington, D.C., where we are trying to have it impact in several different avenues. One is child nutrition reauthorization, which Congress is trying to achieve. They may or may not make it before they have to turn to the Farm Bill. But they can ask USDA to set a standard for added sugar in school meals. This is one standard that's lacking in our National School Lunch Program. So that's that avenue. They can, in the work to develop the new dietary guidelines for Americans, currently underway to develop the 2025-2030 guidelines. We can have more attention to added sugars and their role in chronic disease prevention. And let's see, I had a third added sugar strategy in mind that, the White House Conference on Hunger, Nutrition, and Health, which just occurred a few weeks ago. We did successfully get some mention of need to reduce sugar consumption in the US and outcomes from that conference. And now remains a lot of work to do. And talk to me later about avenues that pediatricians and clinicians can take. So I think I'll stop right there, but I hope that's given a little flavor of how the community-based data can carry through to empowerment and advocacy on all levels.
So I'll share that I think for us as a community-based organization, it has just tremendously built our capacity. I mean, it's different when a parent goes to a school board member and says, these are the concerns that I have about meals, but it's different when that's coupled with research and policy recommendations, right? And that they're very strategic policy recommendations that are helped and developed by community leaders and through that lens, right? And so that has just been really helpful for us to be able to validate the lived experiences of all of our communities and really give them the tools for themselves to feel empowered, right? Like they're coming to these decision makers and they're saying, these are the recommendations that we have, and we have this data, and we have this research, and we really need you to listen to us. And that's become extremely powerful for us. I mean, in addition to that, I think some of the really great benefits have also been just the resources for our organization. Out of the research project, the first research project that we worked, we learned about an agency, No Kid Hungry, that was doing some work in our area in Kern County. And they were very interested in supporting our work and actually funded our community organizing work, which is very, very hard to get dollars for. Community organizing work is the hardest pot of money to find, general operating support as well. And so we were very thankful for that. I would say that one of the challenges is that research takes time, right? And so we're dealing with, people's lives. I mean, one day that we don't change the meal locations or the pickup times means families that don't, a child that doesn't get to eat that day, a child that isn't able to concentrate in school and with their studies, a family that's, living with high levels of stress because they don't have food on the table. And so everything is urgent for us as a community-based org. And so it also meant working with families and helping them understand the process of research and not giving them any false expectations, right? Like this is the way that it's going to move. This is what we can provide. And then working with our researchers and our policy advocates to say, okay, these are the pieces that we can take, so that maybe it's not published just yet, right? But we can take these bits and pieces and we can bring it back to the school districts. And so that has been really, really helpful for us to also just make sure that parents have a good understanding and how we can use this in the future, right? So that they don't feel like this is something that's just parachuting in, because in the Central Valley and the San Joaquin Valley, that happens a lot. There's a lot of health and racial disparities. It's a land of opportunity for research. And so, folks come in and they leave. And so we really had to also make sure that our parents knew that we trusted the policy advocates, the researchers, and build that through the trust that we've built. We want them to know that they can be trusted as well whenever they have these focus groups, because at that time, right, we didn't have, Zoom. And so we were asking our parents to talk to Stanford via phone, right? And so they hadn't even met in person or seen them. And so we really had to work a lot on just building that trust.
I mean, ditto in so many ways. I mean, I think, when I put my organizational hat on as executive director, the benefits are, cachet, money, when I can talk about evidence-based knowledge of why we need to do the work that we need to do. So survivorship funding isn't something we've chased after yet, because we've been focused on the immediate need of a child's diagnosis and the impact on that family. Now we know, because of Stephanie's work, that there are such huge and impacting long-term consequences for this child's original diagnosis. And so it's helpful from that organizational piece. The benefit immediately to our organization and the way that our staff works with families is that they're starting to think differently about a family's progression through their child's diagnosis. So in our follow-up meeting we had not so long ago about their initial findings, we were made aware of something that I couldn't believe we didn't know, which was an end of treatment document that every family is given when their child's done with treatment. We had no idea that that was something that a family would get that would help them understand some of the long-term consequences and at least inform conversation and help us support them. So our staff immediately started calling every family to see. We have one family out of 350 that have an actual copy of an end of treatment plan, one family. So that's huge for us to know that that's something that we can implement immediately into the way that we care for our families. I mean, the benefit of Stephanie's passion and determination to conspire for good is only good for us because it helps us think more critically. It also gives us a new resource and a new advocate. When I came onto the team at Jacobs Heart prior as Director of Development, I coined the phrase educate to empower to advocate as our internal way of being. We want to educate families so that they feel empowered, so that they can advocate for their child. We want to educate siblings on what it's like to be the sibling of a child who has cancer so that they feel empowered to advocate for themselves as a child in that setting. And it goes through every part of our organization all the way through to the external. And this is an absolute reflection of that mission to educate our team so that they're empowered to advocate for children and their families all the way through. The challenges for us in this research partnership have been very minimal, to be honest with you. Jacobs Heart has been a part of other research projects where the challenges were quite extraordinary. The asks from the researchers were exorbitant and took hours and hours and hours of work, of having to work with our families, most who are monolingual, to get the answers to the questions. But because of the trust that we had with those families, we were able to generate that information. This has been very different. The trust that we had with Steph, with Amal, her whole team, we knew right away what their intentions were, and so the challenges were pretty mitigated. Really, the only challenge that we faced was it was a new level of work for our staff. So each case manager has a load of families, and the families whose children are now adults or young adults really are kind of on the periphery, and they might come to an event at Jacobs Heart. They're part of our communications network, but they're not really knocking on our doors or setting aside time or needing counseling services, needing transportation, some of the basic needs that we provide. So now all of a sudden our case managers have an extended load, but they're glad to have it because they understand, because of the findings of what came out of the interviews, we know now that we can help make an impact on these families' lives all the way through. Once a Jacobs Heart family, always a Jacobs Heart family.
That was really powerful. And I want to just stop and thank you for elevating the voice of individuals and families that are impacted by health inequities. And I appreciate your ability to kind of elevate both the real benefits of working with academic partners, but some of the real challenges. I wanted to stop and ask you, if you had a piece of advice for a new researcher getting into the field, how might they get into this work? What advice would you give to them?
Do you want me to start? I would say do your homework. The thing that I think set Stephanie apart coming into our organization is she knew who we were, she knew how we worked, and she came in with something that was really relevant to the work that we're doing. Sometimes really great sciencey minds have great ideas that don't necessarily match up to what's happening day in and day out. And so knowing and being respectful, their team has been so respectful of our time and our workload. And I know a tiny bit about their workload, and so that became this mutual conversation around what are the time constraints, what will this really do, and what kind of impact will it really have. Really understanding the work and knowing that you may have a really great idea, But if it isn't in alignment with the organization, it's not the right idea for that organization. And then make sure that that organization is sustainable and has the organizational structure to support your research. If you come in with a really great idea and they say yes, but they don't have the financial security or they don't have the strategic design that can hold your research project all the way through, it might be troublesome.
I'll just be quick and say that one of the things that I think is super important is just being flexible. And I'll give an example of this. So I mentioned that the number one concern was food, so that's what we were supporting parents with. We were doing the research around addressing food insecurity. And then schools opened back up. And as we returned to in-person instruction, the concern was no longer food. It was still a concern, but the number one concern became COVID-19 safety in schools. Like, do parents know about the protocols? Are students staying safe? Just getting the information, the timely information that they needed to make sure that their child was getting the proper curriculum while also being safe. And so we had parents that were going to school board meetings, and at the time, and in the Central Valley, in the San Joaquin Valley, there were other parents who felt strongly about masks in schools. And so we couldn't talk about nutrition because that wasn't the issue that parents saw as the priority. And so we had to take a pause. We said, well, while we take a pause, let's strategize, let's think about how do we move this work forward while also meeting the needs of families and being true to our values and our mission that is empowering and meeting community where they're at, right? And knowing that they're going to feel supported while also coming back to being able to advocate for nutritious meals. So I think that was really important in Stanford and both the UC Nutrition Policy Institute. We're very flexible in understanding that at the time we needed to just take a break, take a pause, think more strategically about the nutritional pieces, and then come back to it. And we've just been really thankful about that. And I would highly recommend just being very, very flexible with your partners.
That's a great reminder, Cecilia. I just want to say that I think another thing that is critical as you're trying to increase this in your own life is listening to others, being open. It's all about building connections. So you find people out there, find people you can work with. And someone mentioned earlier silos, but it is about breaking down those silos and moving out of your strictly academic track. And that's not necessarily easy to do.
Thank you. So I'm watching the time, and I want to open up the opportunity for folks in the audience to ask questions. Janine and I have more, but I want to make room for others. Does anyone have a question now? Great, thank you.
Hi, thank you so much for joining us today. It was so valuable to hear all of your experiences. I have a question. So there's a lot of academic researchers here who are really interested in being supportive partners to community organizations. And we want to be effective in the issues that we're trying to address together. And a question that I have is, how can we work with community organizations to evaluate our partnerships? How can we hold ourselves accountable and know we're being effective?
That's a great question.
You want to take that, Cecilia?
Well, I think what comes to mind is if I feel like a research partner is effective when you see systems change and community feeling empowered to use the tools that you're providing them. So, for example, just as Christina mentioned, having policy briefs that are in Spanish where parents are taking that information and sharing that with school districts, where Stanford said, we're going to support you in being able to take all of the findings from this project, put it together in a presentation that has digestible information for parents to be able to present that themselves, right? And then also having the opportunity to meet with parents and talk them through the process of really understanding the findings so that then they're able to take those recommendations and share them. So I think I think for me, a successful partnership is just having community feeling empowered by the research and the tools that you're providing them.
I'm an IRB chair reviewing research projects as a regular activity. And one of the items that always comes up is the understanding of the consent form, at least at an 8th grade level. And I suspect in the diverse communities that we've been talking about, or you've been talking about, basically language and really understanding goes beyond just being able to speak English as a second language or Spanish as your second language or whatever. So how much of these issues do you deal with in which people just really don't understand what the research is? They don't understand the words, what they refer to, what the research is actually all about.
Can we take it? That is a huge one for us, whether it's this research project or it's any communication, is being mindful of the way people will actually absorb information and it will be effective. And so in the case of our study, Stephanie really deferred to us to ask, how are these words going to translate? Are they going to translate appropriately? Is the message going to get across? And then how will we actually disseminate the information? And that's where it came back to our team stepping in and being that initial introduction. So each of our family support specialists contacted the families that we identified that would be a good fit for the study, introduced the project, and then let Stephanie and her team connect with them. For us, and I'm guessing it might be true for y'all as well, that it's the trust that we have with our community that helps the communication get through. We are working so intensely with the families that we serve that we know who in the family can speak on behalf of the family, who will be able to take the information and bring it back and make it informative for the family so they're making an informed decision. So for us, it's really the team making sure the information is clear. We went through all of the questionnaires. Stephanie sent that all to us so that we were the ones giving the final check on that to make sure that it was in alignment with what we knew from our community for a communication pipeline. Is that the same for you guys?
And I think this really goes beyond the IRB as well, because in any communication, and all the speakers have alluded to this, but there's your peer-reviewed journal article that hopefully is going to get 300 hits or 800 hits or something like that, citations. But there's translating the findings to a way that works for decision makers and policy makers, and to a way that works for the people who were the subject of the study, or the people in the next community or something like that. I wanted to ask how many of you have ever visited an elected representative's office, either in your state or at the federal level? So a lot, yeah. So you know what their life is like. When you go in there, you're probably talking to a staffer. And you need to leave the staffer a piece of paper that makes the staffer say, gee, this is something my boss needs to know about. And that piece of paper has to have that combination of data that the staffer can look up a few sites and go to the boss and say, look, there's evidence here, and some quotes or photos or stories that catch the staffer's eye in the first place. And that leads me to another challenge that I just really like to bring up, which is capacity to do this whole line of work. It's not just the study, it's not just the peer-reviewed paper, but it's the communications, factoring in translation needs, the taking the research. We talk about dissemination, but what is really involved in the dissemination? These are all the key steps that need a little more funding, a little more attention as you're developing your research plan.
Yeah, Fernando Mendoza, General Pediatrics. California, as you know, is the most diverse state in all of the United States, but Santa Clara County actually is the most diverse county. And that diversity is seen in more than 100 languages being spoken. So what's your recommendations for researchers that are going to go into that environment? Clearly, Spanish is probably the most common, but when you talk about community engagement, I'm not sure that we think about the diversity of cultures and languages And clearly, somehow that has to be part of our understanding of how we approach families. So what's your recommendation of how we can do that better?
I think you got to make sure your team can connect with can speak with the families, can communicate with the families, right?
Yeah,
If you have a research
exactly.
idea, but there's no way to communicate, then it's probably gonna struggle. So I'm sure your team as well.
Yeah, and then just looking for community-based organizations that do have those relationships with
Yeah.
those communities, right? So we, as a Latino majority organization, we, of course, have connection to farm worker families, but we don't have that relationship with, for example, in Southwest Bakersfield, where there is a large Punjabi and Sikh population. And there's a wonderful community organization called the Jakara Movement that does have that kind of relationship. So it's also looking at what existing relationships there are already with community members and community-based organizations, and then partnering with those that have those relationships. I know for us, we also, in addition to Spanish, have Native folks that speak Mixteco, and it means us having to get interpreters and translate documents because it's important that they also feel included. So just really investing, right, in language access. And building those relationships with those folks that already have existing relationships.
Another issue I want to bring up is that as we move so much more towards digital work and we talk about modernizing our food programs and online shopping and everything, it's really crucial to remember that a chunk of the population doesn't have that access for one reason or another. So much as those advances should happen and are great, we also need to make sure that they don't just exacerbate gulfs.
Thank you so much. I want to thank you all for coming here today. Some of you drove quite a long way to be with us, but I think we all really collectively benefited from hearing your insights. We can't do this work without you. We need to learn from you. We want to be your partners. We want to develop those partnerships. So thank you so much.
Thank you.